So we move on with the next presentation. The next speaker comes from Saint-Étienne in the region of Lyon. He's a full professor at the Faculty of Sports Science in Saint-Étienne. He's a coach and consultant for various institutions, and he will have a talk about hamstring injury and sprint mechanics. Jean-Benoit Morin, the floor is yours.
Thank you, Nicolas. Grazie, merci, dankeschön. Now we have to do the full set here. I understood that. Thanks, Mario, for inviting me, and thanks for organizing this way things. It's a great experience for me. First time at Sports Physio, and I realized the entire day long that yes, I was not a physio, but I'm a biomechanist and initially injured football player and sprint coach, so I have all the biases you can imagine. And I'm going to tell you about some studies we did and some research around this topic. So the idea is that we have a collaborative work with physiotherapists and a medical doctor. They are Jordan Mendiguccia. He wrote more than 10 years ago a piece saying that maybe the hamstring prevention process was not heading in the right direction, which means was moving too far away from one of the most common injury mechanisms, that was high-speed running. And Dr. Pascal Edouard, or Professor Pascal Edouard, should I say, is the author of a recent piece that is basically summarizing the arguments towards maybe considering more the mechanics of sprinting in the injury prevention and, let's say, management process. So, by the way, Dr. Edouard and myself has had at least, when we sum up, something like 10 hamstring injuries over our career, so counting. So we kind of have another bias here. And all the places I've worked, or all the staffs I've collaborated with, who are efficient in injury prevention, because the statistics are, not getting better. But locally, some staffs are really improving things, locally. So we have to think about what they are doing. And my experience is that these are places where people work together, really, not in silo, not this is not my part, this is your job, this is our job. And so sometimes you're in the room, you don't really remember who is who, and you cannot identify who is the physio, who is the physical coach, who is the doctor. And these are usually staffs with very good results. So yes, we think that paying attention to the way people run is not a waste of clinical time, and I will try to not convince you. My goal is not to convince people. My goal is to just set what we know, what makes sense, what hasn't been proven yet but makes sense anyway, and what are the pieces of evidence we have. So they allow me to share that because I'm working very closely with them, and in the staff of the AS Monaco Football Club, in the last 2 seasons, they had a huge drop in their muscle injuries, and especially their hamstring muscle injuries. And last season, if I remember well, they had just 1 or 2 sprint-related, where they had their season with the highest number of games because they went to the qualifier for the Champions League and blah, blah, blah. So it means that in this club and in the Osasuna club, where Jordan Mendiguccia is a close collaborator, they have clear results by putting the sprint exposure and the sprint mechanics at the center of the discussion in the club. So I won't be long on that, but you really, I guess, know that both insurance reports, published reports, show that after 30 years of there's an issue and we are doing research, the problem is still a problem. It is, we can argue hours if it's stable or increasing. It is not clearly decreasing. Maybe there is nothing we can do. We have to be humble there. Maybe the players play too much, and that's it. And there's nothing the best programs can do. But again, there are some places where the players play and they are getting better. So yes, you know this kind of studies, I guess. I hope you follow the literature. And in these 2 most recent pieces, the authors explain that, yes, it's still an issue. They detail the stats. And my point is that when you try to see the discussion part on why is it so, I find the discussion a bit limited because it has a capacity-oriented philosophy. It means the discussion is pretty simple. There have been some solutions proven. People are not implementing them enough. That's you can read these papers. That's a quick summary of the discussion, but everything is oriented towards let's get the muscles and the players more robust so they can face more mechanical strain. And I think it's an issue because if you look at the literature so far, on the force, which means the muscle capacity to face mechanical strain, there is a debate on the predictive power of just measuring force and strength, and I hope no one discovers anything here. So, you know, there's studies showing that it is not predictive, studies showing it is, it depends on the cohort, it depends on many things. And the most recent reviews of literature show it is unclear. And the force capacity alone as a prevention power is also debated. So there has been some programs with increasing force resulting in, you know, lower risk of injury. There has been some studies showing the opposite, and the literature so far has, you know, reviews and reviews contradicting these reviews, and it's really not clear. And if it was that clear, then all the staffs would implement, you know, strength approach, and things would get better. But it's not the case. So the overall philosophy is this one. This is a very, very, very simple heuristic of, you know, sprint-related injuries. There is a muscle lesion or a muscle tendon lesion, basically when the system is not capable of facing the mechanical strain that it has to face, you know, during sprinting. And so if we only focus on capacity, then we forget that the other part of the equation is also something we can play on. How can we reduce the strain? So we've seen this morning that a good way to reduce the strain is to stop sprinting, stop playing football, and you know, you will be okay with injuries. But we cannot. We have to do the task. So we don't want to be this type of, and I have worked with many players who had that issue. They were strong. They had everything, you know, and they were at a plateau of their strength capacity, and they still had recurrent issues. Just because maybe the way they were running, their movements, the dose of sprinting they were facing was a strain that was too high for the system to handle. So what are we talking about when we are talking about strain? This is, oh, by the way, strain is for pure biomechanists and mechanics. Sorry, that's not the strain. You can imagine it's an overall summary, you know, of the mechanical strain. If I decide to overarm stretch very hard, I will put a lot of strain on these muscles. This is the type of strain I'm talking about. So there's two types of strain related to sprinting, in my opinion. One is how much people sprint. This is what we could call the macroscopic strain. So this should be handled and managed. And in the clubs I've presented, they manage that very well. They track all the sprint exposure, higher than 90% of top speed. We will see later why. And they try to manage that. But we should also focus on how people sprint. Because if you and I have the same top speed exposure, but my mechanics induce more strain at every step to my system, we don't have the same level of strain. Yet, we have exactly the same sprint exposure. And this is something I wish staff understood, because to me it makes total sense. We don't all run the same. And I guess you know that. So this is the microscopic strain. So if we go back to the beginning of the story, that's the problem. Sprinting and hamstrings are both friends and enemies, which means that many studies show that sprinting is, you know, propulsion, the movement of propulsion is directed by the contribution of hamstrings. There's a lot of very, very well done, you know, biomechanic modeling studies. There's a lot of experimental studies, not using models, but using indirect approaches of a muscle contribution to a movement. Very frustrating. Today, we cannot measure the strength, the force of the muscles during sprinting. So we have to go around and use models and indirect ways. So basically, we know that the hamstrings contribute to a good acceleration and high-speed performance. All right? And you all know that they also get injured during the task. So this is very, very touchy. Another example here is the estimation of the mechanical strain in the muscles. Again, we cannot calculate or measure it directly. We have to estimate things. And we were talking about some limitations of the methods earlier. Believe me, there are a lot of limitations in these methods. But it's still some pieces of information. In this paper from Tellen, almost 20 years ago, they show that when you go from 90% to your 100%, you increase speed by just 20%. but the mechanical strain, that is the negative muscle tendon work, increases by 40%. So it means that there is no linearity between running speed and mechanical strain in the hamstrings. It means just a bit faster, but hugely higher in terms of strain. The most recent study, there's been a lot of studies, and Rod has presented some, but the most recent, and in my opinion, well done, is by Italian colleagues here. They were able to have some measurements of high-density EMG. So we will not open the door of EMG, methodological limitations. But this study presents something that is very interesting. It's the first time that they could get some athletes to their maximum speed and measure the EMG activity of the hamstrings. And what they observed is that this is what you see here. Between 8, so this is the end of the swing phase, and this is the envelope, the normalized envelope of the EMG of the, I guess the first one I showed is the BF, biceps femoris. You see that between 85% of your maximum speed, which is in many clubs the GPS threshold for sprinting. All our thresholds, all the thresholds are very often too low. 24 kilometers per hour for an elite football player is not sprinting. And between 85 and 100, you see that the activity is not a bit higher. It is not 15% higher. It is double, almost. So indirectly, because the strain is a mix between length and activity or tension, we can estimate that the strain at high speed has nothing to do with the strain at 85%. So this is why most of the clubs I work with tend to define 90%. So in this paper, we tried, well, it's not a paper, it's an editorial, but initially it was reviewed as a paper, but we summarize all the things that are around sprinting, and there's many biomechanical variables that cannot be matched or reached in other types of exercises than sprinting itself. Now, in terms of exposure management, I won't be long on that, but 2 or 3 weeks ago at the French Medical Congress of the Football Federation, the AS Monaco staff, so doctor, physio, and sports scientists, presented their data, which is amazing because they are in the elite, they are doing something very good, and they share it with others. And they presented the fact that they were really tracking the amount of sprint meters by each player each week to try and regulate it. Do more, do less, and we try to really carefully regulate it. And they have this type of optimal exposure that was defined initially 7 or 8 years ago. So now let's go to the here. You could say, okay, let's sprint more. That's the way to go. That's, do it, sprint more. I think this instruction could be harmful. Why? Again, because if you say sprint more to a player who is sprinting with very strainful mechanics, you will tell that player expose more to tissue damage. And this might be counterproductive. And you might see people or studies in the next year coming with, look, we have increased the dose of sprinting and we get more injuries. And people will say, we told you we should not sprint that much. And if we don't focus on how they sprint, I think we are missing the point. So, yes, how much is very important, how is also important. So now let's get to the point here. Just for you to remember this randomized control trial, we used, Jordan Mendiguccia set a rehab protocol where sprinting was the key of the rehabilitation. And we paid a lot of attention to sprinting mechanics to try and have people sprint with less mechanical strain. And I will explain you after how. And in this paper here, we had a clear, better rehabilitation when there was a focus on the task that led to the injury most of the time, rather than, or in addition to, the muscle that was injured. And in the last steps of the rehab protocol, there were some cuts on being able to sprint short, middle, long distances. Now here we have decided to formalize things, and unfortunately COVID prevented us from doing the entire randomized control trial, but we did that in the recent years. And in the PhD thesis of Johan Latti here, we decided to propose an individual framework where we consider that there are some risk factors, but every player is different on the set of risk factors that is a priority for them. Because we realized that some players had a very good level of strength in the hamstrings, so this risk factor was not a risk factor for them. They had a very low mobility, so this risk factor was a point, and so on. And each player was, assessed differently here because of their needs. And why we included in our 5 screening or 4 screening categories, of course, age, previous injury is part of the puzzle as well. But here we've included 2 biomechanical variables. The first one was the maximum force output that the players can produce on the ground when they accelerate. We call that F0. That's very simple to get. It's how much your system is able to produce onto the ground. And you remember, the hamstrings contribute a lot to that. Why did we include this? First, because we have several retrospective studies showing that this maximum force output is impaired in players post-rehabilitation. And we have one cohort study that was a prospective cohort study where we assessed 300 players and we had something like 45 or 50 injuries, in which we showed that this maximum force output, as measured pre-season, was not related statistically to the risk of sprint-related injury, but when it was measured in season, closer to the event, we did a time-to-event approach, and if you want the details on that, you just email Pascal, he's a geek on that. But what the results show is that clearly the last measurement before the players get injured has a very low maximum force output in sprinting compared to the uninjured players. So this is why we added that first macroscopic biomechanical variables to the puzzle. The second one is about lumbopelvic control. So some people say this is not clear. It's absolutely clear. It's how your system is able to control the movements of your pelvis and trunk, which means how your neuromuscular system is able to control these movements. And we included that because some modeling studies showed that the length of the hamstrings, so the strain in the hamstrings, depended on the activity of all the other muscles that attach to the pelvic and lumbar region and influence that. So typically, if you contract some of the muscles that attach to the pelvis, they induce a movement of the pelvis. I hope everything is clear with that. And in turn, they influence the stretch of the hamstrings. So there has been this type of studies, and we almost don't need some studies here. We just need anatomy and functional anatomy. These muscles attach to the pelvic bone, and so if I move my pelvis, all things equal, I change the length of my hamstrings, even doing nothing. So figure out, when I'm running at 10 meters per second, when I was running at 10 meters per second, if I change the position of the pelvis, all things equal, I change the length of the hamstrings. And this might be the final tilt of this strain capacity balance. You see what I mean? So we went to try and identify the mechanics of things, and Jordan is doing a huge job there. If you type Marca, so Marca is the sports newspaper in Spain. They have an English version of this article. He did a cadaver study to show the relationship between a tilt in the pelvic angle, degree by degree, and the strain, the mechanical strain in the hamstrings. And not to announce the results before the publication, but some very, very, very small angle variations resulted in pretty large changes in the strain. So it's not about just the pelvis like this or like that. It's a very, very small change. We have also a case study where we were lucky enough to have a hamstring strain during a sprint with an individual that was fully equipped with sensors. So we have all the segments, movements, and you will see the results. It's pretty clear on the ability to control the pelvic and the trunk. So now let's go back to some studies, because there is some emerging evidence. I don't know how many of you in the room really know how much time it takes to do a 3D motion analysis of a maximum speed sprinting step in an individual. It's a huge amount of work, so it's very difficult. And so when studies like this one appear, we need to pay attention. So first, Chris Brahma, a very interesting study. This is not about sprinting, but he was able to show that at the moment of touchdown, so at the moment the ground reaction force is 3 to 5 times body weight coming up your system, there was a clearly higher trunk lean forward and tilt of the pelvis in runners who were, compared to the uninjured runners, having recurrent running type of injuries. I like this type of paper because it's very macroscopic, but the advantage of this type of research is that it tells you where to zoom in to have more microscopic studies. And then I wondered, wow, damn, this is slow speed running. I would love to have the same study for sprinting. But again, what's the big difference between this and sprinting? They are running in place. Sprinting is covering 10 meters in a second. And again, this is a challenge, okay? So then I've connected with Chris, and we've developed some things together. The only prospective study here has only 4 injured players. And we know it's a low sample, but still, all these players had a significantly, you can see the statistics and everything, more tilted trunk and more tilted pelvis at the moment of touchdown, so the end of the swing phase, the moment where, you know, there is a debate on is it the late swing phase or the early stance. There's 10 milliseconds difference between these two, so it's that moment, okay? And you see here what player will be injured later in the season. So there's a higher risk when there's this type of mechanics. So I don't like the term faulty mechanics because we have not enough accuracy there. I just want to list the points that are related to a higher strain. So this was presented at Sport Congress in Copenhagen this year by Chris Brahma. And basically, because we cannot have a 3D motion capture system around players in field conditions, Chris is working on defining a score. So as with any clinical score, it will be qualitative. There will be some inter-raters and all the stuff you can imagine to validate that score. And then we've discussed, because he has some retrospective data and is collecting some prospective data, and we have formalized everything in that opinion piece. So it's an opinion piece in sports medicine that is basically listing all the different mechanics in the sprint pattern that could be related to the strain. I didn't say to the injury risk. I just say to the mechanical strain, all right? And why? And is there evidence? Is there anatomy to support and everything? So read that paper, grab a mug of coffee, because, yeah, that's deep biomechanics. When someone runs in front of cameras, you can end up with 1,000 variables. So we try to zoom in everything here in this table, from the parameters with some support in the literature to those that make sense or have been suggested, but the evidence is not clear, to those that make sense from a mechanistical point of view, but there is no data. Be careful. There is no data doesn't mean it is not a factor. It means there is no data. So we summarize things, and I would like to summarize that on a video. So I was not lucky, because we were measuring things in this professional team, and this is the way to run of a forward, a striker, at the club of Nice at that time, at full speed. So this is the way he runs. We didn't ask him anything but give your max. When you see that, this player is ticking most of the boxes I will list afterwards. And this player is super strong. He has strong hamstrings, okay? He has had previous injuries, and between that season and the first season he played in Newcastle, he had 4, maybe 5, I guess, hamstring injuries. So it means it's a chronic rehabber. And in these running mechanics, and I'm trying to summarize things here, and I disagree a bit with what you said, Rod, there is accuracy in doing slow motion, 2D sagittal plane video with good devices. We can do rubbish things with an iPhone, I know, but when you do things correctly, there's been some validation studies, you can identify things. Of course, you will not be accurate to 0.5 degrees. I'm doing 3D biomechanics. I know sometimes 3D biomechanics is not accurate to 0.5 degrees. But still, between these two players, qualitatively speaking, look at the trunk position. So trunk lean means more mass, more distance on the posterior chain between the two. Trunk rotation. It's not normal to see the back of the shoulder on the opposite side. And the camera is in front. There is no problem of parallax. Okay? The camera and the guys are exactly at the same point in space. Then, of course, here the trailing leg could add some more torque around the pelvis. The heel strike is very, very important, because here, when you strike the ground with a lot of distance in front of you, it means that first, there will be a very big lever arm, external lever arm on the hip extensors. Second, it means that you have to overextend the knee and overflex the hip to reach that point. And all things considered, I think that this player doesn't have faulty mechanics. That's not the way I would term things. But this player very likely runs with a higher mechanical strain, all things equal, in their hamstrings. Okay? Not surprising, so I do it blindly, and then I talk to the students, and I say, what's your sport? Have you been injured? And not surprising, this is a football player, and he told me I stopped after too many hamstring injuries. Okay? So again, I don't say that it is systematic. I just say that sometimes that will be the piece explaining things a bit better. So can we fix that, or can we correct that? The answer is yes. This is a 3D motion capture study where after a gait retraining, we were able to reduce the main factors that I've just presented, okay? And this gait retraining also improved the performance. So this is very interesting because some things that very likely reduce the strain, again, we have no way to quantify it, also play on a better performance. If you want to see the program here, you just log to the Zentrum YouTube channel, and you will see all the exercises, and remember, they all target the same thing. Less trunk tilt, less pelvic tilt, all the 6 big rocks that I have described. No time, but check it, do it at home, and test it with the players. Now, yes, this is about straight line sprinting. We are doing some stuff on football exercises to see if these changes carry on to football situations. And can we really prevent this? So, you know, Kylian Mbappé is both a super fast player and playing a lot, so his macroscopic dose is super high. In my opinion, from what I've seen, and not only from TV footage, his running mechanics are pretty good for mechanical strain. This is his first injury at the hamstrings, and you know that he just changed division regarding the injury risk. What happens here? So this is TV science, but still, you have a very fast runner at almost top speed, very fast, and then you have a defender that is going to grab his shoulder and violently rotate his trunk. I don't know exactly what happened. I was not there inside the muscle to observe, but what we see is both something is pretty well managed, something is rotating the trunk violently, and there is a pain on the other side. Okay, so again, we cannot prevent that because football is chaos and there will be never the same action again. But our goal is to say we should increase the trunk control of the players so that they are better in facing the trunk perturbations, be it in rugby or in football. And this is the work I have started doing maybe now 3 years ago with elite players in different sports, okay, where there might be trunk and pelvis perturbations. My goal is not to prevent injuries. My goal is to make them more ready to face this type of strain. Because I cannot tell this girl, don't do that basketball move because you risk, you know, a trunk perturbation. So to complete and finish my talk here, our next steps are going from consistent coaches' observations, because when you ask the coaches, which means the people who see athletes, you know, every day, every year for years, the mechanics is a point of discussion. And we have started a program here in US football where we want to first test the link between the mechanics and the risk of injury to then maybe have some interventions to help the players run differently, because it is possible. I thank you for your attention, and yeah, don't forget that. Sometimes what really counts is super difficult to count, but still, we can try. Thank you.
Merci beaucoup. Thank you very much. Are there any questions from the audience? Yes, of course. Where are the questions? So I do start with a question, but the next is yours. My question is, can you tell us something about sex-related differences in sprint mechanics and or in relation with hamstring injury?
Unfortunately, not much. And this is a pity. There has not been, you know, many studies around this mechanics assessed at top speed, for example, and mechanical strain. Usually the studies do not focus on mechanical strain, they focus on running mechanics, and we infer mechanical strain. But to my knowledge, there's not enough publication power on girls, and this is an issue. We are working a lot with women athletes, and we see some differences in the ability to control the trunk, but I would say that the differences between the inter-individual differences are the same in men groups and in women's group, which means there's in both groups a lot of variability. I don't have data on averages and so on.
It's not a matter of highest speed, because men have a higher speed.
So
there's not a threshold.
Yeah, you're right.
Absolute.
It's partially, and I think it's also partially a reason why there are some differences in epidemiology and so on regarding this. And to tell you an anecdote on that, we have a basketball player, a girl, an international player, who really developed her running speed because she's a #1, so she has to push the ball over 2 seasons, and clearly with numbers rocketing, and she started to have muscle issues in that process. So yeah, being slow is definitely a good prevention. If you work with if you work with professional players, you see some players by the end of their career who have less and less muscle issues. Despite playing, their speed decreases, and so their strain decreases. But we are on the wrong side of solutions, in my opinion.
Yeah, but then kids have the same, so there are less injuries in kids, and that's why my question, is that really a matter of higher speed?
Yeah, could be.
Or not? Which
could be. Could be, because mechanically speaking, that makes total sense.
Mm-hmm.
I have 2 questions in one from Slido. Would that be helpful to do a training like in track and field, like skipping, foot rolling, or so, to prevent or to, I don't know, to
so
improve?
The answer is yes and no. No, because you don't want to use a type of sport, specific gestures and so on, in another sport. And yes, because you want to adapt some drills, some exercises to the specific sport you're working with, so that the players are closer to what they can really, reach and do. There are definitely some drills in the programs that we have, published, associated with the studies, that I cannot do with some soccer players, because they are just not ready. But as Nick said, we can start earlier, and when we start earlier, we educate more in terms of, their motor pattern and so on. So we adapt things. Yeah, but we have a big rock approach, and it's not about 60 exercises. We have 2 or 3 key exercises that are different depending on the individuals, because the different things that I've listed, some players have only 1 point that is not very good. Some players have 2 or 3, and so you go differently with different approaches.
Okay, we have a question here from a former basketball player.
Boris Gojenovic, merci beaucoup pour la présentation. So we hear a lot about strain, and you're talking about mechanical strain, and I think I maybe understand what that means. I'm wondering, is there a room for any sort of neurological, in the sense of sciatical strain at the connection between the lumbar spine, the pelvis, the hip, and the muscle? Because I think these kind of work together to get the muscle at high intensity.
Yeah, so definitely that was the bottom line of our table. It's mechanistically speaking, it's a possibility that there is like a source of pain in the movement that is related to a less stable pelvis. But to my knowledge, there is no things that have been tested in this direction. Or
should probably go into that, because, I mean, you find that there's some lumbar issues present in a lot of these athletes that have recurrent problems as well.
Yeah, and one thing that I need to mention is that there's also the big elephant in the room that is not present, it's coordination. There has been some studies showing that the best athletes had the best coordination on and off between hip extensors and flexors, and there might be a direction where the coordination is altered. This was suggested by Walter Herzog in his great editorial, saying that we might all be wrong here, it's just an issue with motor control and coordination. If I say that, people will say, yes, but what is motor control? But I trust this approach.
Fatigue might be a denominator there.
Yeah, The funny thing with fatigue, just to 10 seconds, is that we did a study where we fatigued people, repeated sprints. The mechanics change for some in one direction. They change for some others in the other direction. And for some of them, it is stable. So we need nuance, a lot of nuance, yeah, definitely.
Okay, there is time for a short burning question. 1, 2, 3. No, then last question.
Back to Slido. How would you integrate high-strain tasks prior to sprinting in rehab?
Prior
to sprinting?
All the people I work with do it. They just avoid very high levels of loading. So it is strength and strength as a preparation for sprinting before sprinting. Because in terms of tension, in terms of mechanical tension, then sprinting is already going to be, if it's real high-speed sprinting, is going to be demanding. So I would not mix them, in an acute session. I would definitely mix them in a programming, but yeah, it's just for the prep before sprinting.
Okay, great. Then I think we can close the session. So we thank you very much again, Jean-Benoit.
Thank you, merci.
And there is a coffee break, so back here at 3:35. Tschüss.
Just.